Right now, I want you to hold up your dominant hand, the one you write with, and touch your index finger to your nose. Then open your eyes and look at the tip of that finger. Does it feel slightly off? Does it drift even a little before it lands? Most people over 60 will do that test, feel completely fine, and think nothing of it. I need you to keep that in your mind while I tell you something the medical system has largely failed to communicate to the tens of millions of people it affects every single year. There is a type of stroke that produces no dramatic collapse, no face drooping, no slurred speech, no 911 call. It happens while you are sleeping or cooking dinner or watching television. And when it's done, it leaves behind a mark, a tiny lesion on your brain that your body has already quietly filed away. By the time many of my patients come to me, they've already had two or three of these events and attributed every single symptom to getting older. They weren't wrong to think that. What they were was uninformed. And that is not their fault. I have spent over 22 years as a neurologist, specializing in cerebrovascular disease, working with patients predominantly in the 55 to 75 age range. I have sat across from families in consultation rooms and watch the moment they realize the signs were already there. They were already there 6 months ago, a year ago, and nobody told them what to look for. I want to be that person for you today. If you are watching this and you are over 60, hit the like button right now. It takes 1 second and it tells me this information is reaching the people who need it most. And I want you to drop your age in the comments along with one word. Have you ever been told your memory just isn't what it used to be? I'll be watching those comments because what you tell me matters. Stay until the very end of this video because the seventh sign is the one that consistently stops people cold. I've had patients tell me, I've been noticing that for years and I thought it was nothing. It is not nothing. So let me explain what a silent stroke actually is, because the word stroke carries a lot of fear and a lot of misconception. Your brain is fed by an intricate network of blood vessels, some as wide as your thumb, some thinner than a human hair. When one of those tiny vessels becomes blocked, even briefly, a small patch of brain tissue is deprived of oxygen. The event lasts seconds or minutes. The damage, however, is permanent. Radiologists have a term for what's left behind: a lacunar infarct, a small scar. Radiologists find these routinely on MRI scans, and in population studies, researchers estimate that for every recognized stroke, there are up to 14 silent ones that went completely unnoticed. Here is why this matters more after 60. When you are young, the brain has extraordinary compensatory capacity. If one small area goes quiet, neighboring regions step in, they reroute, they adapt. But as we age, that compensatory reserve shrinks, the redundancy decreases, and so when damage occurs, even small damage, it starts to surface, not dramatically, subtly, in ways that get misread as just aging. A standard 15-minute appointment is simply not designed to catch this. There's no blood test for a silent stroke. There's no routine symptom screen. The research exists, it's sitting in peer reviewed journals, but it doesn't make its way into the average wellness visit. So you have to know what to look for yourself. And that's exactly what I'm about to give you. Sign number one: asymmetric facial microexpression lag. I don't mean the dramatic facial droop you see on stroke awareness posters. I mean something far more subtle. Stand in front of a mirror right now, or use your phone camera in selfie mode. Smile, a big natural smile. Now look carefully. Does one side of your face lag slightly before the smile reaches it? Does one corner of your mouth move a half second after the other? This is called facial microexpression asymmetry, and a 2018 study in the journal Stroke found it present in nearly 31% of patients who later received silent infarct diagnoses on MRI. The mechanism is straightforward. The motor pathways that animate the face run through the very areas of the brain most vulnerable to small vessel disease. When those pathways are subtly disrupted, the choreography of your expressions becomes slightly out of sync. You'll barely notice, but it's there. Check right now. Smile wide. Look carefully at both sides. Give it 30 seconds. A patient I'll call Labby came to me at 68. She'd been told by a hairdresser of all people that her smile looked a little different on one side. She'd laughed it off for a year. When I finally got her on the table, we found three small lacunae infarcts in her left internal capsule. We caught it before she had a major event. She's been on a management protocol for 4 years and doing beautifully. Sign number two, episodic word finding interruption. Not the occasional, it's on the tip of my tongue that everyone experiences. I mean a recurring pattern where mid sentence, during a conversation you know well, about a subject you know well, you suddenly lose a word. Not a complicated word, a simple one, a common household object, the name of your doctor. These gaps last 2 to 5 seconds and then the word returns. Patients almost always describe this as brain fog or just getting older. A study published in Neurology in 2020 tracked adults over 60 for 5 years and found that episodic word finding interruption occurring 3 or more times per week was associated with a 2.4 times higher incidence of detected silent infarcts on follow up imaging. The disruption is occurring in the language retrieval networks, most commonly in the left temporal parietal region. The network isn't gone, it's just intermittently losing signal. A patient I'll call Jackie, 63, sharp as a tack, retired engineer, came in because his wife had started finishing his sentences more than felt normal. He'd wave it off in the moment. We imaged him. Two small infarcts in the white matter of the left hemisphere. He's now on antiplatelet therapy, and his wife says the gaps have almost entirely resolved. Sign number three, unilateral grip weakening. Not dramatic weakness. Not dropping things constantly. Go to your kitchen right now and pick up a full water bottle with your non dominant hand. Then your dominant hand. Do they feel identical? Now try this. Press your fingers firmly against a tabletop on both sides simultaneously. Does one hand feel slightly less engaged? A landmark study from the Journal of the American Heart Association found that a grip strength differential of 10% or more between hands, when not explained by injury or known neurological condition, correlated significantly with white matter lesion burden on brain imaging in adults over 60. The grip pathways are among the most finely mapped in the brain. Small disruptions show up there early and specifically. A patient I'll call Leo, 66, thought her left hand was just weaker because she'd been a right handed quilter her whole life. Turned out her grip differential was almost 18%. Her MRI showed scattered periventricular lacunar changes. We got her blood pressure, which had been borderline for years, properly treated, and she's had no new lesions on follow up. Sign number four, sleep architecture disruption with early morning arousal. Not insomnia, not trouble falling asleep. I mean waking between 3 and 5 in the morning. Alert, not anxious, simply awake, 3 or more times per week. The brain's sleep regulatory centers are among the most metabolically sensitive regions we have. When small vessel disease begins to affect the thalamus, the brain's relay station, the normal architecture of deep sleep begins to fragment. A 2021 study in JAMA Neurology found that this specific pattern of early morning awakening was associated with significantly higher rates of silent infarct detection in adults over 62 compared to those with normal sleep structure. This is not stress insomnia. This is a structural signal. A patient I'll call James, 69, had been waking at 4 in the morning for 2 years. His GP had offered him a sleep aid. He mentioned it almost as an aside during his appointment with me. We imaged him. He had bilateral thalamic changes consistent with chronic SMall vessel disease. We completely overhauled his cardiovascular risk management. He now sleeps through until 6 most mornings. Sign number 5, gait initiation hesitation. Here is one you can check in the next 30 seconds. Stand up from where you are sitting. Now walk toward the nearest doorway. Did you hesitate for even 1 or 2 steps before your stride became normal? Did it feel like your feet needed a moment to remember how to walk? This is called gait initiation hesitation, and it is vastly underreported because people attribute it entirely to stiff joints or arthritis. But a study from the Lancet Neurology found that periventricular white matter lesions, exactly the kind left by silent strokes, were the strongest predictor of gait initiation delay in adults over 65, independent of musculoskeletal factors. The frontal lobe circuits responsible for initiating locomotion run directly through the white matter tracts most vulnerable to small vessel disease. A patient I'll call Dorothy, 71, came in for something unrelated and mentioned almost apologetically that she'd been slow to get started in the mornings. Her neurological exam flagged the hesitation pattern immediately. Imaging confirmed extensive frontal white matter changes. She is now in a supervised management program and doing physiotherapy. She told me last month that she thinks her GP assumed it was her hips. It wasn't her hips. Sign number 6, visual field micropsia. This one is subtle and almost never reported because it sounds too strange. Have you ever looked at something familiar? A person's face across the table, a page of text, and for just a moment it looked slightly smaller than it should, or slightly further away than you knew it to be? This phenomenon, called transient micropsia, occurs when the visual processing areas of the posterior brain experience intermittent ischemic disruption. It typically lasts seconds. It's easy to dismiss as tired eyes or a trick of the light. Research published in Cerebrovascular Diseases identified transient visual size distortion as a previously underappreciated marker of posterior circulation small vessel disease, the same territory served by the arteries most commonly affected in silent stroke. A patient I'll call Helen, 64, had been mentioning this to every doctor she'd seen for 3 years. She was told repeatedly it was migraines or dry eyes. When she came to me and described it specifically, I ordered imaging. Posterior watershed territory changes. She had it. We found it. She is being managed carefully now and has had no further episodes in 18 months. Sign number 7, the one I told you to wait for: emotional blunting and reduced empathic response. This is the one that stops people in the consultation room. I ask, have the people you love mentioned that you seem less engaged, less emotionally present? Not depressed exactly, not sad, just flatter. Do things that once moved you to tears or laughter now land at a lower register? Do you find yourself slightly less interested in the emotional content of conversations? The prefrontal cortex and anterior cingulate, the brain's emotional processing and empathy centers, are extraordinarily vulnerable to small vessel disease. And when they are affected, the change is so gradual, so integrated into daily life, that families normalize it. They say, he's just getting older. She's always been private. Research from the Journal of Geriatric Psychiatry and Neurology found that newly emerged emotional blunting in adults over 60, when not explained by depression, medication, or grief, was one of the most specific behavioral correlates of frontal lobe white matter burden detected on MRI. A patient I'll call Thomas, 68, came in not at his own initiative but because his daughter had made the appointment. She sat beside him and said, he stopped crying at movies about 3 years ago. He used to cry at everything. Thomas smiled and said he thought he'd just toughened up with age. His imaging told a different story: extensive frontal white matter lesion burden. We had a long conversation that day, Thomas, his daughter, and me. He told me afterward it was the first time in years he'd felt genuinely heard by the medical system. Now, I want to teach you a simple self test you can do at home with no equipment. I call it the sequential finger opposition test. Here's how it works: hold one hand in front of you, palm facing you. Touch your thumb to your index finger, then your middle finger, then your ring finger, then your pinky. Now reverse: pinky, ring, middle, index. Do this twice, moderately fast. Now switch to the other hand and do the same. What you're looking for: smoothness, equal speed, no skipping or fumbling. If one hand falters consistently, especially on the reverse sequence, or if the dominant hand performs significantly less smoothly, than the non dominant, that is a signal worth taking seriously. A study from the archives of neurology found that sequential fine motor testing detected ipsilateral motor pathway disruption with 72% sensitivity in patients later confirmed to have subcortical lacunar infarcts. A patient I'll call Carol, 67, did this test in my office on a routine follow up. Her right hand, her dominant hand, was faltering on the reverse sequence. She hadn't noticed. She had a new infarct in the right corona radiata. We caught it during a visit she'd almost cancelled. Don't cancel your appointments. Here is your practical framework. Do this in natural daylight or bright indoor lighting, ideally in the morning when you are rested. First, stand in front of a mirror and smile wide. Check for facial asymmetry. Then, hold both hands out, press down on a flat surface, and feel for grip symmetry. Do the sequential finger opposition test on both hands. Stand up from a chair and walk. Notice whether your gait hesitates. Over the next week, note whether you are waking before 5 in the morning on multiple nights. Over the next month, notice whether words are disappearing mid sentence with any regularity. And gently, honestly, ask someone who knows you well whether you seem emotionally different than you did 2 or 3 years ago. Document what you find. Take notes. If you're comfortable, take a short video of the finger test on both hands. Bring this to your doctor. If you notice one of these signs, bring it to your next scheduled appointment. If you notice two or more, particularly grip asymmetry, gait hesitation, or emotional blunting together, call your doctor this week. Not next month, this week. If you are over 60, have high blood pressure, diabetes, a history of smoking, or a family history of stroke, your threshold for calling should be lower, not higher. Please share this video, not later, now, with someone over 60 in your life who might be waving things off as aging. That act of sharing might be the most important thing you do today. And if this channel is helping you understand your own health in ways your appointments haven't, please subscribe. There's more where this came from, and you deserve to have this information. Before I close, I have to be clear with you. This video is not a diagnostic tool. I am not your doctor, and nothing here should be used to diagnose yourself or anyone you love. What I hope I've given you today is an informed vocabulary. The words and observations that allow you to walk into a consultation room and say, I've noticed this, I want to talk about it. That conversation is what changes outcomes. That conversation is what saves lives. The research on silent strokes is clear. Detection is possible, management is effective, and outcomes are dramatically better when these events are caught early rather than discovered in retrospect. You deserve to be part of that early group. Do you remember the test I asked you to do at the very beginning? Touch your index finger to your nose. It takes 2 seconds. It seems like nothing, but for the neurologist sitting across from you, it tells a story. Your body is always telling a story. The question is whether anyone in your life is paying close enough attention to read it. Now you are.